Today's class is going to be, I've named it tongue to toe. So we're going to start with the tongue, which is the deep core line at the very top of the body, right down to the big toe, which is the deep core line at the feet. And really looking at how we can regulate the nervous system by looking at the deep core. So a slightly different perspective than what we've done before. And I was just looking at a few things. If we were to sit in our chair and if we were to slump and think of ourselves as like an 80 to 90-year-old person and just sit in this slump position and stay here for at least 30 seconds, 20, 30 seconds, you start to notice how uncomfortable your body is becoming, how your back is feeling, your shoulders, your neck. My back is already very unhappy even after just 5 seconds of this. So bad postures when we're on the computer, when we're on our phones, when we're on watching television, really taking us into that elderly sedentary posture, which is really, really bad for our body. It's really bad for our nervous system as well. So let's just come back into a better posture because my back doesn't like that, and just maybe have a bit of a wiggle. Also, incorrect breathing. Many of us have gotten into incorrect breathing. And incorrect breathing, it restricts the diaphragm and it creates thoracic stiffness in the spine, in the rib cage. Most people today, they tend to breathe, I'll get rid of my notes, they tend to breathe up here. That's also going to tighten up your neck muscles. It's going to trap the nerves into the shoulders and the arms. It's going to make you feel very anxious, and it's going to raise the CO2 in the lungs. I'm not going to talk for too long. Just some quick pointers. The flexibility of our mediastinum, which is the part of the fascial system behind the heart, really is a good indication of how flexible we'll be in our upper body and in our lumbar spine as well. So if you're quite inflexible through here, then you can expect problems in the neck and in the lumbar spine. Let's just look at breathing now. Let's just put our hands up, one hand on the top of the chest and one hand on the belly. And it's quite good to sit while you're doing this because you get a little bit more feedback. And just take some breaths. And which is moving the most? So for me, definitely I'm breathing. I've had a cold last week, so my breathing's not great at the moment. I can feel the movement in my upper hand, which means I'm breathing apically. I'm breathing into the top of the lungs, not the full right down to the diaphragm and down to the bottom of the ribs. So as you're doing this, see if you could change the breathing status to breathing more into the belly and breathing more into that lower hand. So if you can get 50-50, then that's an improvement, but a good quality breathing is breathing into the lower hand, not so much into the upper hand. Okay, so that's something to think about in today's class. Put the hands on the lowest ribs, so not up here, right down at the lowest ribs. See if, as you breathe in, if you could get the rib cage to flare and the hands to move out. So again, if you're breathing up here, there's not going to be much movement down here. You're going to get very stiff in the thoracic spine, very stiff in your diaphragm and your mediastinum. So the mediastinum is the fascial sac that's around the heart and sticks the heart to the back of the rib cage. So you practice that. You practice breathing into those lowest ribs. So this is called lateral breathing in Pilates. So if you're breathing right into that lowest rib, then you'll be using the diaphragm and the belly will be slightly distending. If we go around, so for decades, we've been taught to pull our belly in and try and pull up through the pelvic floor to look slimmer, but that is going to weaken the pelvic floor and it's going to negatively affect your breathing because you're going to switch from breathing down here to breathing up here to compensate for everything being held in tight. So put the hands under the rib cage and just see now. So we've focused on the side breathing. Let's focus on the top of the breath and the lower part of the breath. So the top of the breath is the diaphragm and the lower part of the breath is the pelvic floor. So as you breathe in, your diaphragm will pull down and you should feel, if you're sitting in a chair, you'll feel the pelvic floor pushing down into the chair as well. And as you breathe out, you'll feel the diaphragm pull up under the ribs and you'll feel the diaphragm pull up as well. So they work together, two diaphragms of muscles, and trying to actively strengthen the pelvic floor is a really negative thing to do. It's going to weaken the pelvic floor. We get the best result just by breathing correctly. So as we breathe in, the diaphragm and the pelvic floor push down. As we breathe out, they pull up. So they're reciprocal, they work together. And that is going to tone and strengthen the pelvic floor. So just practice that a few times. So you're breathing in and you feel the diaphragm pull down, and that pushes the belly out slightly. You feel the pelvic floor pushing slightly down into the chair, and then we breathe out and we feel everything pulling up, and you feel the pelvic floor pulling up. That's the perfect way to strengthen your pelvic floor so that you have a nice control of your bladder, your bowels, good sexual function, good support for the pelvic organs. So we've got upper and lower, we've got lateral. Now we could put one hand on the front of the rib cage and one hand on the back of the rib cage, and just try and take that deep breath into the belly and just feel the rib cage opening out front to back. So you want to feel expansion in the rib cage at the back, the low ribs at the back of the rib cage. Breathing out, feel the diaphragm pull up, feel the pelvic floor pull up. So you're trying to put all those things together, breathing in and the diaphragm pulls down and the ribs expand. You're breathing out and the diaphragm pulls up, the pelvic floor pulls up. One more, breathing in, breathing out. So you're trying to get 360 degrees movement in your rib cage so that you've got flexibility in your thoracic spine, flexibility in the diaphragm, flexibility in the psoas. So the diaphragm and the psoas are connected to each other. You can't separate them when you do an autopsy on a body. They grow into each other and they come together into the solar plexus here. So breathing is a vagal exercise. So let's just do a vagal exercise while we're just sort of starting the class. Put the hands underneath the chair and just take right ear to right shoulder, stretch the left side of your jaw up to the ceiling, and you're going to gently pull on the left hand under the chair, and you're looking with your eyes to the right shoulder. And just breathe. You're looking for the sigh, the yawn, the swallow. So I got mine nice and quickly, and then as soon as you get that release, you're looking up and away. You're just doing it for at least 30 seconds till you get a release in both directions. Nice stretch into the scalenes, which are breathing muscles. The scalenes are the muscles in the side of the neck that attach to the upper ribs. And there's my nice sigh. So gently bring your head back into center. The neck, the scalenes at the side don't like that stretch much, but they feel better afterwards. So hold the underside of the chair, left ear to left shoulder. You're slightly pulling into the right arm to get that fascial connection into the scalenes, and both eyes looking down at the left shoulder. You're looking for the sigh, the swallow, the yawn. So there was my deep swallow, a little bit more saliva in the mouth, and as soon as you get that, you're looking up and away. So really, this is my favorite vagal release because you get the most out of it for the least amount of time. So it's the most effective exercise. So about 30 seconds, support the head, gently support the head back into center, and just move your neck, move your shoulders. So quite often when we're with the vagal system, anything that stresses us, so we've got three vagal states. We've got the calm, relax, rest and digest and heal. We've got the fight and flight, which is in the middle. And then we've got the one at the back in the nervous system is the deep dorsal state, which is one that women get if they're attacked. You know, if women are physically attacked or sexually attacked, they go into paralysis. And so this is the worst part of the vagal system, where the body just goes completely paralyzed in an effort to try and preserve life. So it's quite an extreme form of vagal reaction. And you sometimes get it when people get a shock and they faint. It's all part of that same thing. So maybe something's happening and we're starting to get a little bit stressed. And what will happen to begin with will be our breathing will start to be altered. So as we have that stressor, the breathing starts to speed up, and then the vagal system recognizes that change in the breathing, and then it pushes you into fight and flight. So then that becomes a sort of a cyclical problem where if you get anxious, you get fearful that you're going to go into a panic attack, and then that increases the breathing, and then the reaction's even stronger. So the way to calm yourself down is to focus on the breathing. So there's a form of breathing called Buteyko breathing, which is a Russian therapy, where you just focus on three breaths, start at 5 counts. So you're going to breathe in through the nose for 5. You're going to hold your breath for 5. And what that does is it raises nitric oxide in the lungs. And then if you're doing the Buteyko breathing, you'd breathe out through the nose, but I want you to breathe out through the mouth for this one. So 5, 4, 3, 2, 1. So if you're in bed at night and you want to sleep, you should be breathing through the nose. But when we're doing PRI, which is postural restoration, we'll do an out breath through the mouth. So breathe in through the nose. Hold the breath for 5. Breathe out through the mouth for 5, as if you're blowing up a balloon. So quite a forceful breath. So again, breathe in through the nose. Hold the breath. Blow up the balloon. One more time. Breathe in through the nose. Hold the breath. Blow out through the mouth. So if you did that 5 counts 5 times, you'll immediately stop that vagal reaction that sends you into fight and flight. So it's a really good technique to learn if you're breathing incorrectly, if you're a little bit prone to anxiety. That's going to bring you back into a calm state. If you want to do the Buteyko breathing is for, it calms the nervous system. It raises nitric oxide in the lungs, which is antibacterial, antifungal, antimicrobial, what's the other one? It's anti all the bad stuff, and it also is going to bring you into that calm, balance, rest, heal, and restore state. So it's really good if you can't sleep at night, you just practice. And what you would do then is you would do nose breathing. You breathe in for 5, hold the breath for 5, breathe out through the nose for 5, but then you'll try and increase it to a count of 6. Maybe a count of 7, maybe a count of 8, maybe 9, maybe 10. Some people can get up to 20, but what they say is you don't want to go to a point of feeling uncomfortable. So that just tells you just to find a comfortable breathing pattern where you don't feel that you're stressing your body by holding your breath. And you'll just find then that the nitric oxide builds up in the lungs. If you do that for a couple of minutes, it's really good if you've got a cold or if you've been around someone that's had a cold. It should kill those bugs and viruses before they ever get a hold of your lungs and into your body. So Buteyko breathing is a really nice technique to learn. So let's go to the PRI, which is the postural restoration. We'll get rid of the chair, but we'll keep it because we'll come back to it in a while. So let's just do the postural restoration against the wall. So you're going to have your feet slightly out from the wall. You've got the back of the pelvis on the wall. So the postural restoration work is breath work, but it's working on right side dominance to bring your body and your nervous system back into a more central place. So right arm extends out. Left hand is in the gap between the ribs and the hips, so the waist muscles. And you're going to breathe in through the nose, keep the back of the pelvis on the wall for a count of 5. Hold the breath for 5. Blow up the balloon, so a forceful exhalation, but keep the pelvis on the wall. The out breath might pull you slightly forward. And in this exercise, we allow ourselves to keep going forward. So breathing in for 5, breathe into that right side rib cage. Feel the ribs expand. Hold the breath for 5. Blow up the balloon for 5 and really try to connect with your psoas, your iliopsoas, your obliques. Keep the pelvis on the wall. Breathe in for 5. So maybe you're counting that on your fingers. Hold your breath for 5. Blow up the balloon for 5. Make sure as you come forward, the pelvis stays on the wall. Breathing in for 5. Hold the breath for 5. Blow up the balloon. One more, breathing in for 5. Hold the breath for 5. Blow up the balloon. And on the last one, you drop the arm to reduce the load in the spine and you roll up through the spine. So that one in particular is really for the back muscles, to help the back muscles to relax. So if you're tight on the right, if you're dominant and tight on the right side, it's going to pull your right shoulder down. It's going to rotate your rib cage to the right. It's going to drop your pelvis, and it's going to alter your stance and your leg length. So that's going to create a whole load of problems. So as you come back into a more central stance, you connect with those left side body muscles, then you're going to be moving in a much more balanced body and a much more balanced brain as well. There's more of those exercises on my YouTube channel if you want to look at those. We'll do one more, which is against the wall. So we'll come onto the floor. This one might be a little bit hard to see, but hopefully if you've done it before, you know what to do. You're going to lie on your back with your feet on the wall. You want your knees directly over your hips. And then I want you to use a pelvic tuck to slightly lift your bottom off the floor, just slightly. And then extend your right arm again to the ceiling. Left hand in the left waist to help you connect with those left side deep muscles, and you're going to breathe into the right side of the rib cage through the nose for 5, and count it on your fingers. Hold your breath for 5, but start to push your left foot into the wall slightly, and then as you blow up the balloon, exhale for 5. Feel like your left heel is pushing into the wall but pulling down towards the floor, so you get a connection through the quads into the hip flexors into the abs and the obliques. So again, breathe in and reach through the right arm. Breathe into the right side rib cage through the nose. Hold the breath for 5, and you're already starting to push that left foot into the wall. See if you could find the instep of your right foot. Make your brain work really hard. As you blow up the balloon, you're pushing into the wall with the left foot and you're dragging the heel down. You're finding those left side abdominal muscles. So again, breathe into the right arm, right side rib cage in through the nose. Hold the breath for 5 and you find the right side instep and the left heel pushing into the wall. As you blow up the balloon, you're drawing the heel down towards the floor. And again, breathe into the right side. If you want to make this more effective, hold the breath for 5, push into the wall with the left foot. Try exhaling for 7, a count of 7 or 8, and get even more connection into those left side muscles. So one more time, breathe into the right arm, the right side rib cage, in through the nose. As you hold your breath, find the instep on the right foot, slightly pushing into the wall through the left foot. As you blow up the balloon, see if you could blow out for as long as you can, 7 or 8 seconds maybe. And then when you've done that, just slowly roll down until the bottom is on the floor, and then bring your knees together, roll sideways, come up into sitting and come back up into standing. So you should be now feeling like your short right side is relaxed and opened out a little bit, and your long, weak left side is contracted and pulled up. So that's going to bring your pelvis into much more level. Let's get rid of my jumper. I'm getting warm now, we're working. So let's just come into breath work for the upper body. Just make a soft fist and just rub your breastbone. So we're looking at the fascial system in the rib cage and how we can get quite restricted where the superficial fascial system, the skin and the fascia that's underneath the skin that attaches to what's deeper, can get a little bit stuck. And then maybe just do a little bit of moving the skin on top of the breastbone so that you feel like you've got a little bit of glide there. And maybe just a little bit of tapping into the upper chest. So also part of faulty postures is as we're not using our diaphragm properly, as we're getting into that right side dominance, as we've got tight psoas muscles, we're going to sort of come into the 80-year-old posture. The shoulders are pulled forwards, the pectoral muscles are shortened and tightened, which is going to restrict our ability to expand our rib cage. So tapping under the collarbones above the bra line. Makes your voice go a little bit funny when you do that. So let's do a chest stretch for the fascial system. Let's put our hands just on the upper chest. Put the tongue into the roof of the mouth. So the tongue is the beginning of the deep core. And that goes right down around the heart, through the psoas, connecting into the legs and down to the floor. And so tongue into the roof of the mouth. If I stand sideways, keep your chin slightly pulled in, but just pull down on your chest and look up at the ceiling and just feel how connected we are through the chest muscles, through the fascia of the upper chest, into the neck and the head. So again, and maybe as we look up, we're inhaling. So as we breathe in, the diaphragm is pulling down, the pelvic floor is pulling down. So the pelvic floor is all part of the deep core line. So when people talk about deep cores, they're usually thinking of the superficial abdominal muscles, when really it's the muscles that come right down through the center of the body, along the spine, into the legs. One more. And relaxing. So just a nice way to start to bring ourselves out of that 80-year-old posture into that nice neutral standing, neutral alignment. So let's just I wanted to do some of these exercises. I've done a sort of pick and mix today. Let's just put one hand on the front of the chest, one hand on the back of the rib cage, and let's just gently round forward and then look up. And just sort of go into the bones and just think, you know, what is my rib cage doing? What's my lumbar spine doing as I look up? What's the back of my rib cage doing as I look down? So it's really a little bit like a twerk, but we're just moving from flexion into extension. And I can feel that I'm very tight in the lower rib cage. And because of that, my lumbar spine is a little bit unhappy. So this sort of movement would translate into the waiter or the twerk. So keep the chin pulled in. We don't want too much activity in the neck. You're lifting the heart, and then you're crossing the palms and you're looking into the palms. So you're lifting, and don't think about what the arms are doing. Think about what the bones of your body is doing. As you look up, let the bottom swing out. And as you look in, tuck the tailbone under. Breathe in as you look up. Get the diaphragm working for you. Breathing out as you look in. Breathing in. So maybe the diaphragm's a little bit stiff. Maybe the mediastinum, that part of the fascial system at the back of the rib cage, is pretty stiff and stuck as well. But this is just starting to relax and open up that part of the body. Breathing in. It's a really good exercise for anyone that spends a lot of time sitting or at a computer. So it's the best antidote for taking you out of that 80-year-old woman into a nice, neutral, relaxed stance. So how about we put our hands on the sides of the rib cage, have the feet at hip space. Just think of your rib cage like a bell. So a bell that's swinging. See if you can move the ribs, but not so much the hips. So what your body will want to do is it will want to do this, because then it doesn't need to move the thoracic spine or the lumbar spine. So Think of the lower ribs as the bottom of the bell, and the bell is swinging, it's swinging. So you're getting quite a stretch through the thoracic spine and the upper lumbar. Make sure you're not using the head too much. So again, dominant neck people will be going like this, thinking they're doing a good job, when there's not much happening here, but it's all happening in the neck. So keep the chin tucked and just move through the lower ribs, swinging, swinging. Maybe the bell could swing forward and backwards, forward and backwards. So quite a challenge to the thoracic spine. Maybe the bell could swing in a circle, not moving at the pelvis. So remember, if you move the pelvis and the legs will swallow up that movement and you won't need to articulate your spine. Go the other way. So I'm finding going this way, it's really hard for me to control my pelvis. So this way, my pelvis is nice and still, hardly moving, but when I go the other way, not so good. Quite difficult to disassociate. So what we're doing there is we're disassociating the rib cage from the pelvis, separating. So let's, that's all I wanted to do with the Franklin method. Let's go to the floor, keep the chair, grab your roller, we'll have that in a minute. And I want you to grab your big pillow. So a big pillow, or I've got an air cushion, so I'm going to use an air cushion, but for you, you'd use a big pillow and you'd let your head hang off the back of it. So I want you to put the pillow under your rib cage at the back of your breastbone, so mediastinum. So medial means sort of middle, and sternum, sternal. So you're going to put the pillow under the rib cage, let your head just settle on the floor, have your feet at hip space, knees pointing to the ceiling, and just put your fingers on the rib cage and just gently sway your ribs right to left without moving your pelvis, without moving your legs. So remember, in this one, what's active is the forearms and the fingers. If your neck is really uncomfortable hanging back, you could put a small pillow under the head, but you want to have the rib cage lifted. So you're really working on the spine in the rib cage, on the joints of the ribs. So active relaxation is a really difficult thing to master. If your head's hanging back, just remember to keep your chin slightly pulled in so the neck muscles are stabilizing your neck. Okay, imagine inside the rib cage, so Franklin method imagery, that there's water inside the rib cage and the water's swishing over to the right, it's swishing over to the left. Try not to move your spine in the lumbar spine, try not to move your pelvis, don't move your knees or your legs. Close your eyes and just go inside the body and look at the spine at the back of the rib cage. Look at how the vertebrae are moving, how the discs are moving between the vertebrae. So you're using interoception, your brain's ability to look at the body inside and really make a brain connection with what's happening in the spine, in the ribs, in the fascia at the back of the rib cage, in the muscles of the diaphragm. So if you had time, you'd stay here quite a while. Because we're short of time, we're going to bring our knees together, we're going to roll sideways and bring the cushion down towards the bottom of the rib cage and into the sort of, I'm touching, the pillow's touching the back of my pelvis and it's lumbar spine and the lower ribs. And again, the head is on the floor. If it's getting uncomfortable, you could put a pillow just sort of at the back of your skull, just to support your head and neck. And again, you're going to put your fingers, have your feet at hip space, put the fingers on the lower ribs, and you're pulling down with your fingers on the right side of the rib cage. Let the ribs go back into level, pull down on the left side.
Keep your pelvis really still. Keep your leg bones and your knees pointing to the ceiling, not moving. Close your eyes. Go inside the body and look at the vertebra now in the lower rib cage and the lumbar spine, and see how much you can see and feel the movement in your vertebra, the movement in your discs. Maybe you're noticing that some of these places are a little bit stuck, a little bit tight, uncomfortable. So if it was stiff and stuck, you would just stay here a little bit longer until you just use gentle repetition. So you're moving your ribs and your spine with your fingers, not with your muscles of your core. So you're not actively using muscles, you're not clenching your bottom, you're not tensing your leg muscles, even the neck and the face muscles relaxed. And you're just moving the bones, and you're really looking inside your body to find where you feel stuck, where you feel tight. So for me, I can definitely feel that I'm quite tight in some of my lower lumbar vertebra. And I get very stiff at the back of the rib cage because of lumbar spine issues. So we don't want to be tight through the back of the rib cage. We don't want to be stiff. So then knees and ankles together, roll sideways, and now bring the cushion under the lumbar spine. So right in the middle of your lumbar spine. So you're slightly lifted in your lumbar spine. Put a pillow under your head now, just to make sure your neck is nice and relaxed, nice and neutral. And now you put your hands on the ASIS, the bones at the front of the pelvis. Keep your leg bones and your knees perfectly still, parallel, and just move the right ASIS down, come back to level, push the left side ASIS down. Try not to move in the legs, so you get a really lovely stretch in the hips, and you keep the stretch in the lumbar spine, right side of pelvis down, come back to level, left side of pelvis down, right side. Make sure the movement is being created by the hands and the forearm muscles, not by the glutes, not by the abs, not by the legs. So you're trying to let go of the work in the other muscles of the body. Help them to go relaxed. So use your interoception, go inside your body and just examine what sort of feedback you're getting. Can you see the lumbar spine? Can you see the discs between the spine? Can you see the back of your pelvis? That's an interesting one. Can you see the inside of your hips? So if you've got a very stiff back or a stiff thoracic spine, even a stiff neck, if you do this active relaxation for about 5 minutes, the whole spine will feel much more balanced, your nervous system will balance. So the final one would be ankles and knees together, roll the knees to the side and just lift your bottom and put the cushion under your pelvis. Have your feet at hip space. Again, you're not moving your legs because your leg muscles will absorb a lot of the movement. You're trying to keep the knees pointing to the ceiling, and now you're pushing the right side of pelvis down, come back to level, push with the left hand, left side pelvis down. Imagine the water in the pelvis swooshing over to the right, come back to level, the water swishing over to the left. I'm going to take my pillow away because my neck is reacting to the pelvis. So if you notice anything like that, just deal with it. So I could feel on the pelvic one that my neck started to tighten up because of whatever's going on in my pelvis. So that can be faulty messaging in your nervous system because of long ongoing issues. So don't let the legs do the work. Don't use your bottom muscles. They will try to create movement. Don't use abdominal muscles. Just use the muscles in your arms and your hands to move the bones of the pelvis. Can you see with your interoception? Can you see the back of your pelvis? Can you see your pelvic floor? Maybe take a few deep breaths, so you're breathing into the belly. See if that gives you a better picture of your pelvic floor. As you breathe out and the diaphragm pulls up, can you feel the uplift in your pelvic floor? You're trying to improve the connectivity of the brain through the nervous system to all the deep parts of the body that we don't usually think much about. Okay, come back into center. Bring the knees and the feet together. Take the pillow away. Excuse me. And just bring your knees in for a minute. Bring your head into your knees and just see, how does my back feel? Take a breath. See if you can breathe into the low sides of your rib cage and get that lateral flare in the ribs. Maybe breathing into the back of the rib cage, low down. Gently down. So already, just by doing these gentle exercises and messaging the nervous system, come up into sitting, we should be feeling a lot more relaxed in the rib cage, in the spine, and a lot more balance. So grab your roller now. So let's look at thoracic extension. So many people I see are very stiff in that mediastinal area, very stuck in their diaphragm, very stuck in their thoracic spine, and really affects everything in their body, not just their neck, not just the lumbar spine. So if you're quite flexible, you put the roller at the bottom of the shoulder blades. If you're not flexible, put them in the middle of the shoulder blades. So if you're not sure, go to the middle. And let's just use the bones of the shoulder blades, have the feet hip space, link the fingers. We do this one a lot because it is such an important movement. And you're going to keep your chin tucked and pulled in, elbows forward, so you create a cage that protects the neck. And you're just gently rolling from right to left across the roller. So when you do these movements, there's never a time that the vertebra, the 7 vertebrae of your neck, are moving. They're always chin tucked and they're always in a fixed position. We're trying to move the bones of the spine in the rib cage, not in the neck. So working this area is really going to help if you've got neck stiffness, if you've got breathing issues. Okay, so coming into center, and now keep your chin tucked and just breathe in and look at the ceiling. So use that in breath to create a little bit more stability in your thoracic spine, and then breathe out and look through the knees. So breathe in, look at the ceiling, get that nice expansion. Breathing out, look through the knees. Breathing in. Breathing out, so make sure the bones of the neck are not moving. So now maybe breathe in and go a little bit further if you're comfortable with it. Breathe out, strong abs, use your abdominal muscles to bring the head back up. Breathing in, keep the chin tucked. Just go back to a comfortable place. You want to feel a challenge, but not moving into extreme. So I think 65%. And you'll notice that your neck gets uncomfortable when you're going towards the range that's too extreme for you. Breathing out. So this is specifically working between the shoulder blades in the thoracic spine. It's working on the diaphragm. It's working on the mediastinal fascial sac that's around the heart. So maybe now, if you're feeling comfortable with this, open the elbows, keep the chin tucked, breathe out, close the elbows. So as you breathe in and open the elbows, you're hyperextending in your thoracic spine, the rib cage is opening, getting that nice chest stretch. You're breathing out, you're contracting your abs, you look through the knees. A couple more, breathing in. So using the breath now. Make sure the bones of the neck are not moving. It's the bones in the rib cage. Breathing out. One more. Breathing in. Breathing out. Go back to your side to side sway. So with your right hand, just feel the back of your neck. Find that really big vertebra at the bottom of your neck. So it's the big vertebra is the first of your thoracic vertebra. It's level with your shoulders. You're going to work just below the level of your shoulders, below that big thoracic vertebra, and you're going to lift up your bottom, and you're just at the back of the shoulders, nowhere near the neck, and you're just going to push your body backwards up the roller, and the roller will roll down about 3/4 of the way. As soon as it starts to feel uncomfortable, you stop. You'll start to feel it in your lumbar spine. That's where you stop. And then you roll back to what is thoracic 2, below that big vertebra at the base of the neck. So you're rolling 3/4 of the way down, or just to where it feels a little bit uncomfortable. You roll back up. Add the breath to this. So you're going to breathe out as you roll the roller down. Your lungs are getting smaller, and then you breathe in as you roll back up. Breathing out. Breathing in. Breathing out. Breathing in. Come back to the middle of your shoulder blades. Put the bottom down, and then chin tuck. Just do a couple of breaths just to see how it feels now. Breathe in and open. You should feel much more relaxed. The breath should be much deeper, much stronger. Breathe out, contract your abs, look forward. Breathing in. So you've just created a whole load of space in the rib cage, in the muscles of the rib cage, in the diaphragm, in the mediastinum. Breathing out. So then take your hands to your legs. It's always tricky coming out of this position. A little bit of a kick to come up, and then just go forward for a minute, because you do get quite a reaction in the vagal system in the body after you've done that, because you've really stimulated the vagal system. And so your brain does a little bit of a sort of a moment there, and then you gently come back up into sitting. So let's just get rid of the roller for a minute. I just wanted to, we're going to come into the psoas now, and I just wanted to quickly go through 7 ways that you can tell that your psoas muscle is out of balance. The psoas is connected to the diaphragm. It's all part of your deep core, and it's very connected to the vagal system. So one of the things that you can get if your psoas muscle is out of balance is the leg length discrepancy, one leg longer than the other. You can have knee and low back pain. You can have postural problems that can cause your back to be injured. So you might have a long flat back with a flat butt not being recruited properly, or you might have a bottom that's sticking out and a pelvis that's tipped forward. Both of those are going to create havoc in your back. You might have difficulty with bowel movements. The lumbar, spine, nerves and blood vessels all pass through the psoas into the nervous system. So if the psoas is tight, it's going to affect the nerves to the back. You might have trouble with constipation, with sexual dysfunction. You might have menstrual cramps. That's all part of the same thing, with the nervous system feeding through the psoas into the nervous system. You might have difficulty in breathing because it's going to pull your rib cage forward. You might feel exhausted because the psoas massages the kidneys and the adrenals, and that creates increased circulation, blood circulation to the body. So there's some quite important things there that might happen if your psoas is out of balance. So let's just look at the pillow under the head, lying on our back. Get your neck comfortable, and let's just focus on the right side of our abdominal muscles. Go to your belly button. Go out from your belly button about 3 fingers wide. And I just want you to lift your head up and just feel your 6-pack muscles that go from the breastbone to the pubic bone. So you're just out from the belly button. You lift your head up and you can feel the edge of the 6-pack muscles. I want you to create a blade with 3 fingers. And I want you just to put your other hand with that hand to make a 6-fingered blade. And you're just going to go very gently at the side of the 6-pack, and you're going to aim around the side of the 6-pack and slightly in towards your spine. Be very gentle, because the psoas is an emotional muscle. So If it's out of balance, it's going to be quite a nasty, sharp pain that you feel, and it's going to make you feel a little bit nauseous maybe. So you could come all the way up the six-pack muscles. If you're not sure, lift your head all the way up to the bottom of your rib cage, and you're angling down and slightly in towards your spine, and you're doing this sort of movement very gently with that blade that you've created. You can also go right to left. So the psoas muscle is a big muscle. It's attached from the diaphragm to each of your lumbar vertebra, and you come down to just below the level of your belly button, and then go between your belly button and the ASIS. So this is the part that's usually the most productive. If you were to lift your right knee up, that's where the psoas branches to the side to go under the pelvis into the inside of that right leg. So you're aiming just under the corner of your pelvis, the upper corner of your pelvis. And as you go under the rim of the pelvis, it can be quite painful in here. So just examine. There's trigger points right at the corner of the upper corner of your pelvic bone. So, you know, anywhere between the belly button and the ASIS, you might find there's a little bit of tenderness there. And you can also work down the inside of the inner rim of the pelvis towards the groin. Just be gentle. So if you can feel that the muscle's quite thick here, then your psoas is definitely over tight, overdeveloped, short and tight and bunched up. So usually the active triggers are nearer the top of the corner of the ASIS. So for me, I can definitely feel there's activity here. So this is an emotional muscle. So if you get stressed, if you go into fight and flight, this muscle shortens. So it's all part of the vagal system, fight and flight. It's going to shorten and really get you ready for action. So if we're constantly in a state of fight and flight, then this is seriously going to affect those 7 things that we talked about and create havoc in the body. So I'll go through them again. There was keep massaging as I'm talking. So we had, repaint this, hang on. We had leg length discrepancy, we had knee pain and back pain, we had postural problems where the spine and the pelvis are moved out of place, we have difficulty using the bowels and sexual dysfunction, menstrual cramps, altered breathing because the rib cage is pulled forward, feeling exhausted because of the massaging of the psoas for the adrenals and for the kidneys. So let's go to the left side. Now on the left side, we have the descending aorta. So a big blood vessel that comes out of the heart going into the abdomen. And so we just want to be a little bit more gentle on the left side. So you go to the belly button, you lift outside, go to the 6-pack muscles, lift your head, find the outer edge of your 6-pack muscles, make your blade again, and just here, just be gentle like you were on the other side. But if you feel a pulsing sensation, just slightly move off. That will be your aorta. You don't want to be, you know, pushing too hard on that for too long. So you can work up the 6-pack muscles towards the bottom of the rib cage. Lift your head if you're not sure where the outer border of your 6-pack is. You're working down, and the most productive place is from the belly button, between the belly button and the ASIS is where the psoas branches out into the iliopsoas that goes under the pelvis. So anywhere around that corner, upper corner of the pelvis, you're going to find active triggers. So if you're feeling pain, discomfort, sharp sort of stinging sensation, that means your psoas is over tight. If you're not sure, you could lift the leg up just to find the muscle and then put the leg down. So I'm tight on this side as well. You're going under the rim of the pelvis, and if you can feel the muscle is quite bunched up and quite developed, that's another sign that your psoas is short and tight. So for me, I can feel that things are worse on the left side than they were on the right side. So for me, that's compensation for my SI joint. So you're working down towards the groin. So another way to do the psoas is to have your ankles and knees together, come into a half turned position. So the ribs are staying as they are, but the knees are rolling. And then, so you can do this in bed, and you can just gently work down the six pack, lift your head, working down. And when you do it this way, the organs fall away so that you've got better access towards the psoas and the iliopsoas. It's a good one to do in the morning when you get up. If you wake up in the morning with a stiff back, it's probably because your psoas has shortened overnight. And so if you just spend a minute just going down and relaxing this muscle, you'll immediately find, I'll do the other side, knees fall away, you'll immediately find that your back feels much more relaxed. Lift the head to find the six pack muscles, you're working down, and then you've got much better access to get your fingers under the rim of the pelvis to get to the iliacus. So for me, when I did that, definitely very tight on. So you'll have it in both sides, but one side probably will be worse than the other. So bring the knees together, roll over sideways, come up into sitting. So let's keep an eye on the time. Let's grab our roller again. Let's come into adductors. So we talked about this one before. We've got 3 adductors. We've got a long one, a middle-sized one, and a short one. The short one goes from the, if you make the sort of a visual for the underside rim of the pelvis, goes from the underside rim of the pelvis to just slightly out to attach to the leg bone. So if you think of the underside rim of the pelvis as a clock, your pubic bone is 12 o'clock. Your sit bones are 9 o'clock and 3 o'clock. And I want you to be working between 9 o'clock and 12 o'clock on this left side. And I want you to be, you're coming onto the end of the roller, sort of towards the end of the roller, and you're just sort of outside of the bone. So you're not on the underneath part, which would be painful and delicate. You've got the rim of the pelvis, and then you've got the muscles that are attached to the rim of the pelvis. So you're sort of here in the muscles that are just underneath. So this is a sort of release that only you can do, because it's a part of the body that you wouldn't want anyone else to sort of massage. But you could just use your roller. So I'm not quite on the end of the roller. I'm just pinning the muscle against the leg bone and the roller. And now I'm just applying pressure. So you can just roll out this adductor magnus, it's called. Probably better if I do it this way, and then you can actually see. So I'm sort of on near the end of the roller and just doing between 9 o'clock and 12 o'clock. So if you went between 9 o'clock and 6 o'clock, that would be a release for glute maximus and some of the deep rotators. So all I'm doing is I'm just sitting and holding. And if you've got definitely pelvic floor, if you've got pelvic floor dysfunction, if you've got SI joint dysfunction, the adductors get too tight and they're all connected into the pelvic floor, and then that will distort the pelvis, and then that will fire up the SI joints, the hips and the back. So it's a good one to keep an eye on. And you just pin it and hold it for about 90 seconds. And then you would do the other side, which would be between 12 o'clock and 3 o'clock. So you're not on the rim of the bone, you're just outside of the rim of the bone, where the muscle moves out from the pelvis into towards the femur. So if it's sore here, then you know that you're quite tight in these muscles. So again, calf muscles, adductors, they're silent muscles. They don't tell you that they're tight. And so you often don't realize that they're a problem, but if they get too tight, they're going to create havoc in your pelvic alignment. So again, you stay here for about 90 seconds. It's a good one just to do a couple of times a week, just to make sure that things aren't getting too tight. The other thing you can do is you could sit on a ball, on a chair,
and put the ball in that same place, and that will just help the muscle to relax. It's very hard to stretch out adductors. It's very hard to release them because they are so strong and so dominant. So it's a good one to know. So then we're going to come into the other two muscles, and one comes to about halfway down the femur and one comes a little bit higher up. So the triggers are about, if I stand up, the triggers are about here. So about a quarter of the way down from the lower rim of the pelvis. And you'll know where they are because it's quite painful usually. So get the end of your roller, oopsie, that way. So have it at sort of 45 degrees and just pin where those triggers are. Oops. So you sort of got to move around a bit until you find them. And then just move the foot up and down. If you feel a pulse, remember that's your femoral artery. Just move slightly and then you're not pressing on the artery. So this one, often you don't feel anything much at first, and then as the muscles relax, then the triggers appear, and then suddenly it gets quite uncomfortable. Keep an eye on the time. I wanted to get to the feet to finish, but we might be running out of time here. Okay, so then we would go down to the calf. So we're still working on the deep core line. So you're just rolling out the inner calf. Make sure your shoulder and your hips rolling together. Even 20 seconds here, you're going to make a difference. So very active triggers here for me. So you can see how we're connected from the big toe up the inside of the leg into the pelvic floor, through the psoas, iliopsoas, psoas, up into the mediastinum, into the neck, into the tongue. So all connected and all very much talking to the nervous system. So let's do the other side so we don't run out of time. So we're going to angle the roller at 45 degrees. We're going to come about a quarter of the way down from the pubic bone, say, and we're going to pin the inner thigh, and we're just going to use the foot lift to really create shear force massage. So shear force massage is when you're using the bone in the body, in the leg, to pin the muscle against the roller. So the bone is rotating internally, and that's pushing into the triggers in the muscle. So it's quite a strong form of massage. Okay, so if we run out of time, you can always go back to this after the class. So inside of your calf. So if you felt like there's some really nasty triggers here, maybe just give yourself 5 minutes afterwards just to repeat and spend a bit more time here. Make sure you're rolling the shoulder and the hip roll together. You don't want your spine doing something horrible. I think we're just going to get this in. So then finally, coming to standing, just to finish, grab your ball. And we're just going to finish with feet. So if we're focusing on the deep core line, the ball is going to go at the base of the big toe. I might need to pop that down a little bit. All of the big toe, the base of the big toe, and just really rolling up that middle line from the big toe to the heel, a medial line of connection through the tendons from the big toe. So you're going up from the big toe. The other toes are part of the deep core line as well, but it's mainly the big toe because we pitch on the big toe, up through the inner calf, inner thigh, pelvic floor, iliacus, psoas, diaphragm, pericardium, mediastinum, into the neck, into the tongue. And, you know, the torso part of that has got a huge connection in the nervous system. So we'll do the other big toe through the vagal system. So the vagal system only really goes to the torso, but there are 11 other cranial nerves that go to the rest of the body as well. So it's quite a complex subject. So just going from the big toe to the heel, just to really work that, and then maybe just do a few for the other toes. So that was tongue to toe, and its connection with the vagal system.